Hi everyone, my name is Anne. I'm a pharmacist in the hospital, and today I want to do a personal campaign about COVID-19 and how to protect you and your family safe. First of all, the resource I would recommend everybody to go to is using the CDC website for cases as well as ways to protect yourself. Second, I really want to urge everybody to focus on the facts, not what you see on social media or what others are telling you. Focus on the facts and find the source of truth, which is WHO and the CDC. And their websites are constantly updated. Second, please keep calm and just really be logical in this, especially there are folks around you that rely on you. So for this video, I'm going to talk a little bit about COVID-19 and how it spread, and then just some things that I have noticed as a pharmacist in the hospital and what we all can do to keep each other safe, as well as keep those that truly need our help safe. So first, how does it spread? So currently, the best way to avoid getting the illness is by being exposed to it. So the virus is thought to be spread from person to person, most likely between 6 feet, hence the social distancing is 6 feet. And that's because through respiratory droplets, aka through coughing or sneezing, another person can be inhaling those droplets into the lungs and get infected. Another way that may be getting that virus is that these are droplets, and if they are on any surfaces and you touch them and you touch your mouth or again, from a respiratory standpoint, you will also may get infected. So what should you do in this scenario? First, you want to clean your hands as often as possible. You want to clean it with soap and water for at least 20 seconds. So sing the happy birthday song, especially after you've been in a public place or blowing your nose, coughing, or sneezing. And if soap or water are not available, hand sanitizer that has 60% alcohol is also effective. And last, avoid touching your eyes, noses, and mouth with unwashed hands. In addition, it's best to avoid close contact with people who are sick, and then put your distance between yourself and other people if COVID-19 is spread in your community, which at this point we do have community spread. What community spread means is that folks are getting sick without a known source where they've traveled or the infected individual. So, and there are cases now that folks are getting sick regardless of travel or being exposed to an infected person. So what is the take-home lessons? Stay home if you are sick, because again, you can be technically contagious even though you're not sick. And the symptoms to some people who are healthier or younger may not manifest as much compared like a mild symptoms versus someone who's older, over 60, or patients with immune system are suppressed, like a organ transplant or stem cell transplant. Those type of patients are at higher risk, hence they may, even when they get the virus, they will be at higher risk of getting severe symptoms and eventually could cause death. So in this case, what you should do to help others, first, cover your coughs and sneeze. And in this case, it'd be good to also wear a face mask if you have a face mask available to you. Immediately wash your hands with soap and water for at least 20 seconds. And if you have any symptoms of sickness, coughing, or again, I know we all have allergies during spring season, so we tend to sneeze. But with everybody being so on high, I would call anxiety, even if you're sneezing because you have allergy, people don't know that. So they get extra cautious and anxious. So my recommendation is also wear a face mask. And of course, wear a face mask when you're sick to avoid getting others infected. In addition, even if you're not sick, you don't need to wear a face mask, because actually wearing face mask is protecting the other individuals. But if you are healthy, you may not need to. However, now with the community spread, you really don't know who has it, who doesn't. So you may very well have it, but your immune system is good and you may not even exhibit any symptoms, yet you're transmitting. So if we do have a mask, I would recommend to wear it, especially when you go to public places, grocery stores, and everywhere that you go that you may be in contact with other individuals. Or even if you don't plan to see other individuals, you might just even wear a mask because your droplets may be on surfaces, and the best way is to protect yourself as well as protect others. One thing I really want to talk about is I've heard there are a lot of questions, a lot of my friends as well as family asking about, is there a cure for COVID-19? And so I'm going to share some of my knowledge as well as experience as a pharmacist. As of right now, there is no true cure for COVID-19. There are a certain number of medications that are supposedly will work for COVID-19 virus. However, it's not a true guarantee. And not all COVID-19 positive patients need the medications. It is only reserved for patients that are very sick. For example, where they're going to be admitted to the hospital or going to the ICU where they cannot, where they need additional respiratory support or additional support, versus if you are having mild symptoms and you are able to stay home, those patients, you can actually stay home and be quarantined for 14 days. And then from there, you can actually hopefully recover as your immune system helps you. With the number of medications and the number of potential patients out there, we do not have enough medications for every single individual that are COVID-19 positive, that are having mild symptoms or severe. Hence, the medications really, truly for those that need it, aka very, very sick patient in the hospital. So with that, I really encourage folks to not think, oh, regardless of where you get the information, because I have friends who say, oh, now there's a cure, so we're good. No, there is truly no cure at this point as I'm doing this video. There may be a cure in the future. However, these medications are not true cure. Again, they show some activity against this virus and potentially can help these patients who, for example, in the ICU, who needs to be intubated, cannot breathe on their own, and their respiratory function is decompensated. AKA, they cannot breathe on their own and they need either other types of machines to help them to support their breathing, in addition to medication to get off this infection. So with that, there is currently not an FDA-approved vaccines right now. It is currently being studied and shows some promising results. However, with how vaccines are being manufactured and made, it's not going to be immediately available. So what that means is that it's going to take some time for it to be available. So the best way is to prevent yourself from being exposed and expose others. Okay, I wrote down a few things on my notes here, so I want to make sure I cover. So I really want to urge everybody to flatten the curve. There have also been questions asking about the number of beds available in hospitals and why are we talking about the surge in hospitals and there might not be enough beds for all patients. So I want to use an analogy similar to the grocery store. If I have 3 customers, I can ring the customers one by one very easily. However, as things get very hectic and crazy, we have 20, 40, 100 customers. I myself cannot ring every single person's up. So that will create a bottleneck. So that's the same thing as hospital beds. We have beds, let's say in ICU, we have 20 beds. So we can accommodate 20 patients and help them in terms of all the, again, these are severe patients that needs ICU beds or just hospital beds that need some more medication to treat their disease. However, I'm just going to stick to ICU because that's just make it simple. There are 20 beds, we can put 20 patients, but if 40 patients shows up on our service, we don't have 40 beds to provide. And when we're talking about beds, we're just not talking beds alone. We're also talking about the number of respirators, the number of medications, the number of nurses, staff. So it's really creating a bottleneck. And what flatten the curve means is that we try to reduce the number of exposures, aka reduce the number of individuals being affected, and that reduces the number of sick individuals are super sick that needs to be admitted to hospital. So that will kind of slowly, because if 20 beds are available, we can treat those patients, they get better, they move out to a general floor bed, and then if more patients come, maybe 10 will come, then we'll be able to kind of do that little musical chair. However, if we have 100 patients or 200 coming all at once, they're physically not able to have all the supplies, all the staffing, all the medication all at once for all these patients. So that's why it's so important with social distancing and for you to flatten the curve, aka keep the number of individuals infected to minimum, aka that less individuals are infected, so less severe sick individuals. There are few individuals that are higher risk than others. For example, those are over 60, like I mentioned, as well those that have their immune system is compromised. Overall, there are a lot more disease states that come with immune compromised patients, but essentially where their immune system is not able to fight the virus like a healthy individuals. Don't get me wrong, this virus is also very dangerous and very lethal when it comes to healthy patients or healthy individuals, but the rate at which we see is it tends to cause more severe illness in older individuals or individuals with immune system where they're compromised compared to healthy individuals. I hope that makes sense. So what can you do? Really try to engage in social distancing, aka stay away from large gathering, even family gathering. We don't know who we've gone to. We don't know where we've been, who we've talked to, and those are all source of potential spread. Limit your shopping, limit your going out to essential items like getting gas, getting groceries, and even going to groceries. You may not need to go once a week, and maybe try to go every 2 weeks or every 3 weeks. I'm actually stretching mine out to every 3 weeks right now. Just trying to be creative, and then trying to go super early in the morning or go late at night, and then having hand sanitizers, or just really clean your hands almost every surface you touch, because you don't know where things have been or who have touched them. So that will also help. On my last segment, I really want to recognize that in addition to our nurses and our doctors that take care of all the patients, there are many behind the scenes individuals and heroes to keep the hospital running and to keep our patients safe, including, I'm going to make a list, but they're not exclusive. I'm sorry if I missed some other individuals. So for example, pharmacists, pharmacy technicians, our respiratory therapist, our physical therapist, our unit secretary, our social work, our environmental services staff, our facility staff, our security staff who keep us safe, our chaplain who provide comfort and emotional comfort for our patient and family, our patient liaison, our volunteers, and so many, many more. Our supply chain who helps with the amount of what we call personal protective equipment, and many more individuals to keep the hospitals, the clinic, the facilities running. And I want to deeply, deeply thank them for their service. We go to work for you. Please stay home for us. Thank you.